Amyotrophic lateral sclerosis, ALS, also known as Lou Gehrig's disease, is a progressive neurodegenerative disorder that affects nerve cells in the brain and spinal cord, leading to muscle weakness, paralysis, and eventually, respiratory failure. It's a devastating condition that not only affects individuals physically but also emotionally and financially. In this comprehensive guide, we'll delve into all aspects of ALS, from its causes and symptoms to diagnosis, treatment options, and ongoing research efforts. Understanding ALS. ALS primarily affects the motor neurons, which are responsible for controlling voluntary muscle movements such as walking, talking, and even breathing. As the disease progresses, these motor neurons degenerate and die, leading to muscle weakness and atrophy. The exact cause of ALS is still not fully understood, although researchers believe that a combination of genetic and environmental factors may play a role in its development. Symptoms of ALS. The symptoms of ALS can vary from person to person, but they generally include muscle weakness, twitching, and difficulty with speech, swallowing, and breathing. Initially, individuals may experience subtle symptoms such as tripping or dropping objects, which gradually worsen over time. As the disease advances, paralysis sets in, eventually leading to complete loss of muscle function. Diagnosis and prognosis. Diagnosing ALS can be challenging, as there is no single test that can definitively confirm the disease. Instead, doctors rely on a combination of clinical symptoms, neurological examinations, and various tests such as electromyography, EMG, and nerve conduction studies. Unfortunately, there is currently no cure for ALS, and most individuals with the disease have a prognosis of 2 to 5 years from the time of diagnosis. However, some people may live longer, particularly if they receive early and aggressive treatment. Treatment options. While there is no cure for ALS, there are treatments available that can help manage symptoms and improve quality of life. This may include medications such as riluzole and edaravone, which can slow the progression of the disease and reduce muscle stiffness and cramping. Physical therapy, occupational therapy, and speech therapy can also be beneficial in maintaining mobility and communication skills. In some cases, assistive devices such as wheelchairs and ventilators may be necessary to help individuals with ALS remain independent for as long as possible. Research and hope. Despite the challenges posed by ALS, there is hope on the horizon. Researchers around the world are actively studying the disease, searching for new treatments and potential cures. Advances in genetics, stem cell research, and neuroimaging techniques are providing valuable insights into the underlying mechanisms of ALS, paving the way for innovative therapies and interventions. Clinical trials are also underway to test promising new drugs and therapies, offering hope for the future. Support and resources. Living with ALS can be incredibly challenging, both for individuals with the disease and their caregivers. Fortunately, there are numerous organizations and support groups dedicated to providing assistance and resources to those affected by ALS. These organizations offer a wide range of services, including support groups, educational materials, financial assistance, and advocacy efforts. By connecting with others who understand what you're going through, you can find comfort, advice, and practical assistance to help navigate the journey with ALS. Conclusion. In conclusion, ALS is a devastating disease that affects thousands of people worldwide. While there is currently no cure, there are treatments available to help manage symptoms and improve quality of life. Ongoing research efforts offer hope for the future, with the potential for new therapies and interventions on the horizon. In the meantime, it's essential for individuals with ALS and their caregivers to seek out support and resources to help cope with the challenges of living with this condition. By staying informed, connected, and proactive, you can make the most of each day and continue to live life to the fullest despite ALS challenges.